Alright guys, Cadizsh Norford here, Mr. Hit the Kick Sweat. We're important and lively. We're about to go through a nice little upper body relief stretch exercise that you can do 3 times a day, every single day, to help relieve the body from the cervical to the thoracic spine, the rotator cuff, some of everything, alright? See you soon. Alright guys, so first exercise we're gonna do, well, not an exercise, first stretch relief we're gonna do is the sternocleidomastoid. Alright, very big mouthful of words and letters jumbled together. Anyways, sternocleidomastoid, it's right here, right where your ear is on the lateral side of the head and neck, runs all the way down into the clavicle. What happens is when you rotate to your left and your right, what happens is when you rotate left, the sternocleidomastoid shortens to the left side and the back side lengthens. The problem is if you were to lay bad, or if you were to have bad posture doing desk work, or if you were standing too long leaning on the elbows, or someone who suffers from protracting shoulders, what happens is when you go to rotate, due to that shortness in the fascia, it prohibits your ability to access your full natural range of motion to go into rotation both laterally from the left and the right. So what we're going to do is we're going to alternate stretching that puppy, and I'm going to show you how to do that. First, before you do, we're going to stretch the right side lateral sternum. So what we want to do is we want to retract the right shoulder, but first we want to access our natural range of motion first. So what we're going to do is we're going to bring the left ear to the left shoulder, keeping the chin-centered chest, but open chin off of the chest. We're going to take that right shoulder and we're going to retract them down. So you want to get the posterior view to see the retraction of the shoulder. Hold on, over here. Alrighty, so if you're somebody who lives in a big city, you're dealing with heavy traffic, bumper to bumper, stop and go, somebody doing office work, a lot of desk work where you're on the desk, using your postural muscles, they get fatigued and you start slouching, utilizing the elbows to compensate, to keep the chest up. Or if you're just somebody who suffers from protracting shoulders, what we want to do is we want to help teach you how to relieve your cervical spine. Alright, it's the spine that's behind the head and neck. What happens is our postural muscles, when we utilize them in the isometric contraction, which is little to no movement, but yet they're contracting to hold and stabilize and secure muscles like your latissimus dorsi, pectoralis major, as well as your minor, which is in the armpit. Last but not least, your rotator cuff, your lower mid-trap, and your rhomboid. These are all postural muscles that work in force-couple relationship to help you maintain that posture when you're sitting for consecutive hours. So what we're going to do is we're going to teach you how to relieve all of those postural muscles to make sure you're able to keep your posture at an optimum. We're going to bring, sorry, I'm like squinting really hard. You see I'm frowning. I'm not upset. Just got the sun out. We're in Miami. It's beautiful. It's today, but guess what? We don't play. We still got the work to do. We got to stay and remain consistent. So remember, we're relieving the cervical spine. We're going to bring the elbows up in the path of the shoulder. So you want to keep the left elbow in the path of the shoulder and the right elbow in the path of the right shoulder. You don't want to bring them any more narrow. Why? Because you may pinch the clavicle while you're trying to go for that stretch. Now, we're bringing the elbows, path of the shoulder, interlacing the fingers behind the head and neck. Neutral spine, all right? We want to maintain a nice long spine. We're going to tuck that chin, keeping the elbows in the path of the shoulder, retracting the shoulders down, keeping the big chest. Big chest, again, bringing it back in the path of the shoulder. Big chest up and through, bringing those elbows to the fork of the ribs. Elbows to the fork of the ribs. Open it back up. You want to repeat those puppies at least 5 to 6 repetitions for 3 sets to help relieve that cervical spine. I promise you'll get that red blood circulation starting to flow. breaking up that lactic acid, helping help relieve that muscle so that you don't feel the aches and pains over time. Alrighty, so we're gonna work on the upper body stabilizer. So I want you to understand throughout every single workout that has to do with upper body, your rotator cuff helps stabilize yourself. What we're gonna do is we're gonna help with external and internal rotation with optimum neutral spine to help really open up that connective tissue to help increase that functional mobility. Now, the problem sometimes you may see is that range may be prohibited when you're going from external to internal rotation. Over time, I promise, you will get there eventually, but you gotta start somewhere. So what we're gonna do, we're gonna bring the elbows up, all right? Elbows have to be shoulder height. You want to keep them shoulder height because you want to keep that rotator cuff nice and calm while you go for the range, okay? Chin center, chest neutral, spiny. We're gonna go for that external rotation. Now, when you go for the external rotation, I want you to get that lateral view so you can see what happens when you have tight shoulders. Now, I'm pretty sore from an upper body workout, so you'll see the inversion of the thoracic spine. You don't want that. You want to pull your hips underneath you. Keep your hips underneath you, engage your core, keep your glutes engaged, and work your rotation. External rotation, pressing those elbows out in abduction. Internal rotation, keeping the elbows shoulder height. Again, you want to keep those hips locked underneath you so that you don't invert at your thoracic spine. You want to keep that spine nice and neutral. And boy, can I feel that in my scapula, a little bit of my rhomboid, definitely the lower mid trap. So remember, postural muscles that'll help you in a force couple relationship to maintain your posture. Latissimus dorsi, pectoralis major. The most common underactive ones is your lower mid trap, your rhomboid, as well as your rotator cuff. Now what we're gonna do is we're gonna go after all of the combination of the three, okay? Including that rotator cuff. Why? Because again, what happens is when those shoulders get tight, you start to protract forward, which then leads to the tension behind the head and neck, behind that cervical spine. So when we did that chin tuck, we not only got the lower mid trap, the rhomboid, the scapula, but we got a muscle that's hiding in there called the levator scapulator. Runs deep from the cervical spine all the way down into your lower mid trap. So understand your muscles are right over these areas, and the minute that fascia starts to shorten and get tight and it starts to ache and it disrupts the vertebrae. So we want to make sure we relieve these puppies. So what we're gonna dive in that posterior kinetic chain. Working the protraction and retraction, absolutely, very important. Make sure you hit that retraction when you're working out that upper body. Now we're interlacing the fingers, keeping the fingers center chest as well as the chin, open chin off the chest. Now, I'm gonna work my reach. I want you to work your reach and protraction to really get that posterior deltoid, open chin. And then we're gonna retract with an open chin, retract. Going through that range right now, you can really, I'm feeling the crack, 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 left and right. Now what we're gonna still maintain the transitional movement between protraction and retraction, but what we're gonna do when we're going in protraction, we're gonna tuck the chin, all right? We're gonna tuck the chin center chest. So we're gonna hit that protraction, reach, reach, reach as far as the body naturally can go, tucking the chin center chest. Now, one of the things you want to make sure, and this is something I learned through yoga trainings, you want to connect that you're breathing with your movement transitions. That way you're making sure you're properly dispensing the red blood cells, which is very important. As you can see, as I was deep breathing, a nice deep inhale and a nice deep exhale as I transition into the protraction and retraction, it starts to get the red blood cells flowing. Pretty sweaty. We drippy over here. Now, what we're gonna do a little bit more functional mobility. So this is gonna be a combination of the totality body. All right, we're gonna get the hip flexors, we're gonna get the quadriceps, as well as the glutes. What we wanna do, we're gonna continuously work on that cervical spine because that's the main focus for today. We're gonna continuously keep the chin tucked into the center of the chest, bringing the elbows and knees. So let me stop talking, let me show you. we're gonna work our functional range, so it's absolutely important for you to have the feet shoulder hip width or just slightly wider. All right. Now, what we want, we're gonna go with the interlaced fingers behind the head and neck. Yes, I get the work in. You see those calories. We stay consistent. Now, as we go into the squat, we're gonna squat elbow to knee touch. Reaching up. Now we're gonna go for a high arch in the cervical and thoracic spine to help relieve them. Alright, so we're going to knock down the anatomy that we've taken care of today. All of the major postural muscles that you utilize in isometric contraction to help maintain that position that you're utilizing at the desk. Pectoralis major, pectoralis minor right here in that armpit, rotator cuff, the lower mid trap, the rhomboid, as well as the scapula right here in the shoulder blade. Last but not least, we got the anterior and posterior deltoids with the shoulder reach protraction, the chin tuck as well as the retraction, opening up that chin, keeping a neutral spine. Now, last but not least, tucking that chin, got the levator scapulae, was the sneaky one. If you're using the pillow and you're laying on your back and you're not really transitioning throughout your sleep, what happens is it gets a little achy behind here. So we got that puppy with tucking the chin, and you want to do that 5 to 6 repetitions for 3 sets, 3 times a day, every single day to help relieve that spine, all right? Now, last but not least, we forgot the anterior scaling, all right? He's another sneaky one that likes to hide. Right on in here. Right in here. That's what he is, right there. Now, what happens with the scalings is what we want to do is we want to be able to open that chin, keeping a neutral chin. Now, when you hear instructors say open chin, that's to stop the tension behind the levator scapulae. So if you keep your chin tucked, you're going to create tension in the fascia behind the head and neck, which is going to disrupt your posterior kinetic chain, starting from the cervical spine where the levator scapulae is, all the way down the lower mid trap, going into the rhomboid. So if you see, it's a domino effect, all right? So what we want to do is we want to keep the open chin. We're going to slightly open them up over top of the shoulder. We're going for the right scaling. So what we want is you want to pull them nice and easy, nice and easy. Chin center chest, slight rotation, open chin, slight rotation to the opposite side so we can get that, utilize that left side scaling. So you want to elongate them, reaching for the range first. You want to go right where that clavicle starts in the center of the chest, where your sternum is here, but your clavicle starts to begin here. That's where you want to put your palm at. Open them up. Booyah. Alright guys, Cadizsh Norford, Mr. Hit the Kick Sweat. I hope you enjoyed those relief exercises that you can do to really help train your flexibility training. Now remember, while you're training your resistance training, utilize the correct exercise to help strengthen muscles, the underactive muscles that is, or if you're utilizing flexibility training to help relieve the overactive muscles. You need to make sure you're doing both of these guys and coupling them together. A combination of the two always will get the job done, not one without the other. Now, if you enjoyed these stretches, please comment below. Let me know if you have any other opinions, if you want any other exercises to be done. Tag me, My Muscle Motivation, on Instagram. Don't forget to subscribe to the channel to get more premium content. Cadizsh Norford, aka Mr. Hit the Kick Sweat. See?